Good morning, and thank you for joining us for our weekly update. I'm pleased, as always, to be joined by Dr. Lawrence Lowe, our Medical Officer of Health, Darren Rizzi, our Fire Chief, and our Director of Emergency Management, Sam Rogers, our Director of Enforcement, and this week we have a very special guest, Inspector Peter Danos from Peel Regional Police. Before I give my weekly update, I'd like to say a few words about the attack that took place in London, Ontario this past Sunday. My deepest thoughts and condolences are with the 4 members of the Asphalt family who were targeted and murdered in a shocking act of terrorism. With the family's 9-year-old son, Fayez, who was seriously injured in the attack and who no longer has a father, a mother, a sister, or a grandmother. And with the London community and all Muslims in Canada who are deeply hurt that something so terrible and so hate-filled could happen in our country. No matter how many times we say anti-Muslim hate and all forms of hate will not be tolerated in Canada, heinous acts like this one continue to occur. If we truly want to eliminate racism and hate, then we have to be more honest with ourselves. We have to be honest that prejudice against racialized and marginalized group still exists within the hearts of too many people in this country. We have to be honest that too many of our public and private institutions continue to undervalue the lives of some members of our community and that systemic racism, discrimination are real and pervasive. We have to be honest that so much more needs to be done to ensure that all groups in this country are included in the decision-making process at the highest levels of power. If meaningful change is to happen, then we have to ask ourselves what we are doing as individuals, as governments, and as private institutions to not just denounce racism and discrimination, but to build inclusivity in everything we do, which ultimately means mutual understanding and respect and challenging existing prejudices. We must do more to elevate the voices and stories of racialized and marginalized groups. This is a time to mourn, but it's also a time for deep reflection, honesty, and a renewed commitment to building a more inclusive society. I extend my love to the entire Asphalt family, the Muslim community, to the people of London who must now grapple with the reality that such an abhorrent act has happened in their city. The people of Mississauga stand in solidarity in the grief with the entire community. We mourn together. So Mississauga, tomorrow at 12:01 a.m., we will enter stage 1 of the province's roadmap to reopen. This is a significant step forward, and I know how important even limited reopenings are to so many of our small business owners, our residents, and our families. And I want to thank the Ontario government for giving businesses advance notice, which gave them the time that they needed to recall staff and place orders of inventory. This is something I had been asking for, along with the other mayors right across the GTHA. But there are the big changes taking place. Very big changes will be taking place tomorrow. Social outdoor gatherings and organized public events of up to 10 people are now permitted. Outdoor religious services, rites, and ceremonies, including weddings and funerals, are permitted with a cap of the number of people that can maintain a safe physical distance of 2 meters. Indoor religious services, rites, or ceremonies, including weddings and funerals, are permitted at up to 15% capacity of the room. Non-essential retail is permitted at 15% capacity with no restrictions on what can be sold. Outdoor dining is permitted with up to 4 people per table, with exceptions for larger households. Outdoor fitness classes, training, and outdoor individual and team sports training is permitted for up to 10 people. Day camps, overnight camping, and short-term rentals are also permitted in Stage 1. City staff are now working hard to open even more of our own city facilities. And I'm absolutely thrilled to announce that we will be opening up Celebration Square Wading Pool tomorrow with a 60-person capacity. It will open daily from 10 a.m. to 8 p.m. No reservations are needed, and people can simply head right over to Celebration Square and dunk their toes in the water. Staff will be on site to make sure physical, safe distancing guidelines are being followed. I'm also really happy to announce that 2 of our outdoor pools will be open. Our Lions Club of Credit Valley Outdoor Pool and the Streetsville Outdoor Pool will be open as of this Saturday. I know that this is really important for so many of our residents who don't have outdoor space, outdoor yards, or even air conditioning at home. There are capacity limits, and residents can book a spot online up to 5 days in advance by visiting activemississauga.ca. Other city-run outdoor pools across Mississauga will open on Saturday, June 19th. Residents are also able to book at activemississauga.ca. People can book permits for our outdoor sports fields and picnics starting tomorrow for groups up to 10 people. We have received a lot of requests from fitness, martial arts, and dance studios to rent space within our parks. We will be accommodating these requests, and staff are going to be very flexible to provide park space for these types of businesses who have been hit very hard by the pandemic. The easiest way to book a permit is by calling our customer service center at 905-615-4100. I'll say it again, 905-615-4100. Outdoor programs like instructional golf, tennis, and fitness will begin on Saturday, June 19th, with registration open today at activemississauga.ca. It's hard to express just how excited I am to share all this great news with you. I know how important these reopenings are to our business owners who have suffered so much throughout this pandemic. I know how important these reopenings are to so many of our residents, our families, and our children who have been waiting to get back to the activities that are so important to them for their mental and physical well-being. And it is truly because of all of you, our residents, that we are at this point. We are where we are because of your commitment. And this is a very cautious reopening, and so we're very supportive of it. We are here because so many of you continue to listen to the advice of public health. Our case numbers have plummeted dramatically in this past month. Peel Region is now averaging 61 cases per 100,000, significantly down from 100 per 100,000 last week. Mississauga is averaging just 58 cases per 100,000, and that's down from 80 a week ago. We haven't seen numbers this low since last mid-October. And I really want to put in perspective how far we've come in just 1 month. When I gave my update on May 12th, Peel Region was averaging close to 300 cases per 100,000, with Mississauga averaging 240 cases per 100,000. Our hospitals were at a breaking point, transferring out dozens of patients every week to other sites across the province. Today, things have stabilized, with Trillium dealing with 40 COVID hospitalizations, 17 patients in the ICU, and another 37 suspected cases. William Osler Hospital in Brampton has 33 COVID hospitalizations, 11 patients in the ICU, and another 31 suspected cases. This is huge progress, and it's also in large part because so many of our residents have gone out and gotten their vaccines. I'm absolutely thrilled to report for the first time right here, right now, that 75% of our residents 18 plus or older have now received their first dose of the vaccine. This is our big goal from the start, and reaching it is an incredible achievement. I want to thank everyone in Mississauga and across all of Peel region for going out and getting their first dose. I also want to thank Dr. Lowe and the teams at Peel Public Health, Trillium Health Partners, William Osler, as well as our doctors, our nurses, our paramedics, our firefighters, and the volunteers who have been helping to get shots in arms. And on top of that, about 40% of our residents between 12 and 17 have received their first dose. In total, that's more than 1.1 million people right here in Peel that have now had their first dose coverage. We are now making headway on second doses as well, with everyone 70 plus who received their first dose of Pfizer or Moderna on or before April 18th now eligible for second doses. Peel Public Health and our hospital partners are ramping up capacity again to get as many people as possible their second doses. I encourage everyone who is eligible for their second dose to book one as soon as you can. If you haven't received your first shot yet, please do so right away. The easiest way to book is by visiting peelregion.ca/COVID-19 vaccine or by calling 905-791-5202. I'll say it again, 905-791-5202. This is all the good news. The not so good news is that we are seeing a steady rise of the more transmissible and more severe Delta variant right here in the region of Peel. 30% of all the new cases here in Peel are now the Delta variant, which has the highest concentration in all of Ontario, right here in Peel. And we know that one dose of the vaccine is only 33 to 52% effective against the Delta variant. We are right on the cusp of reopenings, and with the new variant in the mix, it's critical that the Government of Ontario moves back to a hotspot strategy for second doses. We have to douse the fire where it's burning the strongest. We need to get second doses to our large number of essential workers who don't have the luxury of working from home. Residents who go into our factories each and every day to keep our supply chains intact, keep our economy running, and keep our shelves stocked. Peel and Toronto drove the third wave across Ontario, and we could potentially drive a fourth wave. We saw how effective the initial hotspot strategy was and saw that the government sent 50% of all vaccines to hotspots for the first 2 weeks of May. It allowed us to quickly open up the vaccines to all our residents, but in particular, our essential workers, and that reduced case counts, stabilized our hospitals, and got all of Ontario out of the third wave. COVID-19 has not affected regions equally. Peel has 10.5% of the population, but still accounts for more than 20% of all cases. Let's get vaccines to where they're needed the most. Doctors and health experts, including Dr. Peter Uni, Scientific Director of the Ontario Science Advisory Table, says this is what the government needs to do. As we ramp up capacity here for second doses, I'm once again calling on the Government of Ontario to do the right thing and to send hotspots like Peel more of the vaccine and give us the flexibility to lower the age eligibility. This has to be the last lockdown. Mississauga, we're about to enter a very new chapter in this long COVID journey. I encourage everyone to get outside with their family and enjoy the outdoor amenities. Go swimming at one of our outdoor pools. Get out there and play some baseball or some soccer or some tennis or some golf. And please, Go visit one of our fabulous restaurants and enjoy a drink or a meal on the patio. And stop in at one of our amazing small retailers. Right now, we have to show small businesses our support as they begin to reopen, as it's essential for them to not only survive, but to once again thrive. Please continue following the advice of public health and book your vaccine as soon as you are eligible. And with that, I'd now like to invite Dr. Lowe to the podium.
Thank you, Madam Mayor, and good morning. Mississauga's weekly incidence rate for COVID-19 currently stands at 58 per 100,000 with a test positivity of 5.6%. As of this week, Peel Public Health has been in emergency response for over 500 days. However, thanks to your sacrifices, our third wave is starting to resolve. As Madam Mayor announced, I am pleased to also share that our community has achieved 75% first dose coverage of our 18+ population. However, despite all this good news, we know that only one dose is partly effective against the Delta variant, which continues to advance across Peel. So as we move towards step one of reopening tonight at midnight, I want to urge a cautious optimism as we gradually step out of the shadows of COVID-19. Please don't forget the sacrifices that have got us to this point. We have been in one form of lockdown or shutdown since October, and that worked. It saved lives, and this is why we have had the lowest intensity of the pandemic in Canada out of all the G7 countries, save for Japan. Canada now also has one of the highest rates of first dose coverage in the world. We have saved countless lives and spared many families from the misery of chronic COVID over 3 waves, through the heroic efforts of our healthcare and public health professionals, as well as the essential workers who couldn't work from home, and the sacrifices of our small businesses, our community, our school children. Like everyone else, knowing all this, I want tomorrow's opening to be the start of our final exit from the acute phase of the pandemic, a gradual, slow move out into a post-pandemic future. But as with anything in life, if we force this too quickly, it will fall apart in our hands. So to that end, the formula is quite simple. I urge you to continue limiting as much as possible your contact and interactions. Until we get to widespread 2-dose coverage and have the Delta variant held at bay, it's best to still favor outdoor gatherings, ensuring that you are distancing and masking, and avoiding large crowds, particularly with people that you do not live with. Please get your vaccine. The products are safe and effective and has been borne out in the data in our long-term care homes and across the province in our declining case numbers. If you haven't had a first dose yet, please get one now. 75% is a commendable achievement, and it's taken our whole community to get here, but we need to push that higher. The vaccines are close to 100% effective against death and severe disease, regardless of the variant, and they help to reduce transmission and infection. And if you've gotten your first dose already, please get your second dose as soon as you're eligible. 2 doses will help to limit any resurgence that might be driven by the Delta or other variants, which is increasingly replacing the Alpha variant as our community's primary circulating strain. With our hospital partners, we are again ramping up to maximum vaccination capacity here in Peel. Like in mid-May, we are bringing online expanded mobile offerings, expanded operations at our fixed clinic sites, and we'll be looking at other workplace and community offerings in the near future with additional allocation. We are taking seriously the warnings received from our science table partners to ensure that we get ahead of any resurgence and allow our community and our province to move forward with reopening with confidence. I'm hopeful that the province will provide Peel and other hotspots with Delta transmission activity with additional supply and expanded eligibility to make the most of all the capacity that we are bringing online. As allocations were reduced in the past 2 weeks of May, we acceded to ministry direction and reduced our capacity accordingly. However, we're not waiting, and we are not sparing any moment in trying to get back to mid-May, where we administered almost 170,000 doses in a single week. The faster we get through to second doses, the faster we seal the deal here in Peel and for Ontario, and continue to move through the steps of reopening to finally put this acute phase behind us. So I encourage everybody in Peel, get your first if you haven't, and for your second, stand by. Thank you, and I'll pass it back to Mayor Crombie.
Thank you, as always, Dr. Lowe. And over the last month, especially as the weather has gotten nicer, my office has received so many calls and emails about speeding, dangerous driving, road racing, and excessive vehicle noise in Mississauga. Inspector Peter Danos is in charge of road safety services with Peel Regional Police, and I've asked him here today to talk about what police are doing to crack down on dangerous driving in our city. So, Inspector Danos, the floor is yours.
Thank you, Madam Mayor, and good morning. In 2017 and 2018, Peel Region saw 3 fatalities directly related to street racing. In 2020, we saw a record and horrific 43 fatalities and 51 life-altering injuries, all from preventable collisions. In many of these cases, the speeds involved would have been deemed as stunt driving or aggressive driving. Due to the noted avoidable tragedies, Peel Police Road Safety Services has adopted the Community Safety and Wellbeing Service Delivery Model to better align with the Region of Peel's Vision Zero goal to reduce deaths on roadways per capita. 1 preventable death, 1 life-altering injury is 1 too many. The following initiatives have been put in place as speed calming measures. Chief Nishan Duryappa increased the road safety complement by 16 officers. This translates to approximately $1.7 million in human assets annually. An evidence-based strategy is being relied upon to deploy officers in data-documented high-risk collision areas. In May of this year, the Safer Roads team was formed to address organized stunt driving and racing events and to proactively investigate Peel's top 30 dangerous offenders. This innovative and first-of-its-kind team is also dedicated to Joint Forces Erase Program, an acronym which stands for Eliminating Racing Activities on Streets Everywhere, and is dedicated to preventing car racing meets before they happen, in partnership with our neighboring police agencies and city bylaw officers. Since its May 1st inception, the racing calls for service in the Region of Peel have been reduced by 50%. Specific to Mississauga, from January to June of last year, 382 racing calls were generated. Year to date, only 178 so far. Peel's road safety team will always listen to the public's concerns related to vehicle speeds and noise pollution. Project Noisemaker has evolved from a blitz to an annual enforcement commitment. Between July and December of last year, 1,020 noise-related citations were laid. So far, 1,010 for noisemaker charges this year. Peel Police have also escalated speed enforcement. To put this in perspective, a total of 1,200 stunt driving charges were laid in 4 years, 2016 to 2019. In 2020 alone, 825 stunt driving charges, 600 stunt driving charges year to date so far. Further, an additional 10,000 speeding charges laid in the Region of Peel, half of those on the City of Mississauga roadways. In December of 2020, Peel Regional Police was consulted for recommendations that were included in the Moving Ontarians More Safely Private Members Bill. If passed, this legislation will increase aggressive and stunt driving penalties. Peel Police understands that road safety is a priority to our communities and our families. I encourage the public to forward their concerns to the revamped Road Watch program that can be easily found on our website. We will follow up with you, I promise you that. All this said, enforcement or policing our communities is not the only solution to preventing these tragedies. We have endeavored upstream approaches to address impaired driving and recidivism by referring drivers affected by addiction to our Peel Addiction and Assessment Referral Center partners. Peel Police have also partnered with the Mississauga Road Safety Committee to launch successful educational, social development, speed calming campaigns such as Take the Pledge Peel and Slow Down. Unfortunately, our region has seen 11 lives lost on our roadways this year. We believe the aforementioned social development, risk mitigation, and prevention strategies have contributed to this downward trend. Thank you, and I'm available for any questions.
Thank you, Inspector Danos. And before I take questions from the media, I just wanted to mention one more thing. Yesterday, Mississauga achieved 2 firsts among Canadian cities. With Council's approval, we became the first Canadian city to become an active member of the Cities Changing Diabetes Program, a partnership between Novo Nordisk and more than 30 cities across the world. That helps cities tackle type 2 diabetes, which has become a huge public health issue in Mississauga and in Peel. We also became the first Canadian city to be awarded an ISO certification by the World Council on City Data, reaffirming how we have become a Canadian leader in adopting smart city technology to improve the lives of our residents. And now, we are all ready to take questions from the media, myself, Dr. Lawrence Lowe, Darren Rizzi, Sam Rogers, or Inspector Danos.
The first question is for Dr. Lowe. It comes from Steve Cornwell at the Mississauga News.
Morning, Steve. I'll ask Dr. Lowe to come forward.
Go ahead with your question, Steve.
Good morning, Dr. Lowe. Just a question around the cases that have been plummeting, obviously, in recent weeks, but I'm wondering if you're anticipating with reopening kind of coming tonight that there will be a spike in cases, and if so, do you have a kind of an idea of what a spike in cases may look like?
Yeah, Steve, thanks for the question. We know that with any reopening, there will be an increase in contact and interaction numbers, which is why I've really requested that our community not give up the gains that we've had, both in getting to 75% first dose coverage and also in beating back the third wave. So it's really vital that we emerge gradually into this reopening plan. It's not time to go from 0 to 100. I would encourage people to try to keep the powder dry as much as possible and really just slowly increase their contact interactions. We do know the first dose coverage is a benefit. We do know that it is only partially effective against the Delta variant, which is becoming more and more proportion of the positive cases. So really there's a lot of different lines that are crossing here, but the hope, of course, with a first dose coverage of 75%, a receding third wave, and hopefully people just remaining sensible about the nature of recognizing this is not a full reopening. Any potential increase in cases would be limited or mitigated. Thanks for the question.
And Dr. Lowe, my follow-up is actually for you and perhaps Mayor Crombie as well.
Okay.
I've seen some of the language has been released around day camps, at least in Mississauga. It seems to be that the city is planning to kind of work with you and Peel Health on kind of implementing health plans for opening them up safely. Are you anticipating that, based on the age groups of the day camps, that kind of a vaccine passport thing or a first vaccination might be required in order for participation in day camps?
I think that would be a decision left up to the individual operators as to how they would proceed, but certainly it's one of many different tools in the toolkit that would be involved in trying to trying to keep individuals safe in those programs. You've also got the cohorting, the screening, all these other things that would typically be used to support safety in day camps. But obviously the decision to require proof of vaccination is usually left up to individual programs at this point in time. I don't believe it would be a requirement, but certainly something that would be actively discussing. Thanks for the question.
Thanks, Steve. And let's also remember that only children 12 and up are eligible for the vaccine, right? So there is no requirement yet for a vaccine passport, but we do know that governments right across the world are talking about it. It is something being discussed.
Your next question comes from Isaac Callan at the Pointer. Go ahead, Isaac.
Good morning, Isaac.
Good morning. Hey, I want to ask yesterday about the cannabis debate. Obviously, slightly a fulsome conversation, and I think something, you're very keen on putting forward a united face for council and having, these like council companies' decisions together. But yesterday we saw a lot of presentations, and we saw a lot, opposing views being traded in a way that's actually quite rare, I think, on Mississauga Council. Do you think it's good or bad for your council to have these more oppositional debates in public, perhaps more than they do?
My council are very dedicated. They do their homework, and we do have very robust debates. This is not unlike, I think I mentioned it yesterday, the Uber versus taxi debate. So I will say we are sometimes slow adopters. Sometimes it takes my council members a little while to warm up to an idea, so we've mused about it initially. We said, look, there are certain criteria we expect from the provincial government before we will opt in. And you know what that is. We wanted greater control over zoning with stores not permitted near sensitive use, which we defined more broadly than just by schools, drop-in centers, daycares, youth groups, etc. And we didn't want a clustering or a concentration of these stores in any one area. Now, we wrote to them and they said, thank you for your letter, but we're not changing our rules. And so we thought we'd take some time and learn and watch the experience in other jurisdictions. And certainly in my view, in the view of Councillor Karen Rass, Councillor Matt Mahoney, and Councillor Sue McFadden, the sky didn't fall in those jurisdictions. It was introduced very responsibly. These stores are clean and safe. It helps us move away from the illegal market. It is a legal product and should be sold legally, even in Mississauga. So that was very much our view, but my councillors, they were, towards the end of the debate, we're willing to discuss a pilot project once again. So we'll see where that goes in the months to come, Isaac. I believe councillors Ron Starr and Carolyn Parrish will draft a motion with respect to the proposal of a test pilot where we could have more control over the zoning and the clustering, and we'll see if the provincial government will approve it. I suspect they may not, because we would be one out of 445 municipalities asking for special rules to apply to us. But you never know. Maybe if they want Mississauga to opt in, they'll give us the pilot project.
Follow up, Isaac?
Yeah, just specifically on the issue of these more complicated topics, these more controversial topics, where councillors, like yourself and like Matt Mahoney, change their mind. And we don't see those views traded quite as opposition, I think, in Mississauga Council. These topics sometimes don't come up in this way. Do you think the public gains when you have those discussions where you're trying to change each other's minds in public rather than agreeing on the same topic or just sharing residents' views?
Isaac, I'm very proud of my council and the open, robust, honest, and frank debate that we have with each other. We have a lot of mutual respect and admiration. That said, we all have different views. And yes, Councillor Mahoney and I did change our votes because we were both cautious in the beginning and wanted to observe the experience in other jurisdictions. And I quickly learned that I didn't feel it was in our interest to hold back any longer. It's a legal product, as we've already said, and it should be purchased legally. And there were no serious side effects in those jurisdictions that chose to opt in. So he and I both realized it'll be okay to proceed. We've been cautious. We've been watching their example. We were hoping at least three or four more might join us, but they're being cautious, and I don't blame them. I mean, we put our mark in the sand, which was this is our criteria: a change of zoning, more control over where these stores will go, and a lack of clustering. And so, until the provincial government allows us to have more control over that, I don't think we'll bring too many others of the councillors on side. But no, I think the fulsome debate is in the public interest. I think it makes us very accountable to the public and very transparent, very open, and we are always very frank. And they do their homework. They're well educated and they're very passionate about their city.
Your next question comes from Jeffrey Allen at Mississauga. Go ahead, Jeffrey.
Welcome, Jeffrey.
Jeffrey, are you there?
A question for Dr. Lowe.
Yep, no problem. We'll ask him to come to the podium. Thank you.
Go ahead, Jeffrey.
Dr. Lowe, a report came out of your office yesterday about the extension of the mask update through the end of September. The majority of Peel residents have had their first vaccine, second doses are ramping up, optimism is abounding, and Peel residents have spent the last 15 months largely obeying the mask mandate. Can you explain why you decided to recommend what appears to be the most strict masking rules since the pandemic has begun, perhaps even in North America?
Absolutely. So our team has been looking at data very clearly. We know that there have been significant drivers of transmission in our community, and we identified through our outbreak data that insufficient masking was a large part of the reason why exposures were occurring. And in the face of the Delta variant and in the face of reopening, I think it's very clear that one-dose coverage is, as I've mentioned, only partially effective. So to the extent that we want to ensure that we can continue to move forward with reopening and continue with confidence, we're hopeful that while these mask measures may seem quite stringent, they will only be with us, hopefully, for a few months more as we really just try to get over this final hump onto the finish line.
Follow-up for you. Aren't you concerned this kind of strict rule might actually increase anti-mask sentiment? And might it just be better to continue with the existing rule rather than trying to get people to comply with a more strict version of it?
I think anti-masking sentiment is going to exist regardless of what masks are recommended. I think we have to make our decisions based on our data and on our science to really ensure residents know how they can protect themselves through ensuring that they're wearing better masks. This is not meant to be punitive. This is meant to be protective. Thanks for the question.
Next question, please.
Your next question comes from Khalid Salama at My Second Home TV.
Welcome, Khalid.
Go ahead.
Thank you. Good morning, everybody.
Good morning.
I have a question for both of you and Dr. Lowe about the strategy of the herd immunity. Do you think you have to review it, revisit again, especially on the light of the latest stats, and also with the intention of the federal government to ease the restrictions a little bit on the airports and also for the returning Canadians?
Yeah, so with respect to the airport restrictions changing, I believe that's not effective until July. That gives us the balance of the month of June to continue to get second doses in arms, and we're making great headway right now. As you know, we're 75% vaccinated 18 plus. We've got about 40+% of our 12 to 17-year-olds vaccinated, and we are working on second doses, but I think we're only 6 or 7% of 18 plus for second doses. But clearly, with a second dose hotspot strategy, we can move that along a lot faster. So we're very hopeful. We understand there may be an announcement by the provincial government today or tomorrow, and so we're very hopeful that they will once again give a higher allotment to hotspots like Peel in Toronto so that we can get our second doses up and get to that herd immunity point as soon as possible. Because of course our goal is to be 75% fully vaccinated before the fall, hopefully before the end of the summer. Dr. Lowe, would you like to comment on herd immunity? No, he agrees with me. All right, Khalid, he says, yes, she's got it. Okay.
You got
Follow,
it.
Caleb?
Yes, thank you. That I believe will be also for you and Inspector Dennis.
Okay,
A couple of
Inspector
days
Dennis.
ago in the area of Ridgeway Drive in Eglinton, an unmarked police cruiser pulled a small Toyota Corolla for 10 minutes to hand over a ticket actually to the driver who was doing 70 in a 60 zone. And having heard what Inspector Dennis said in the morning, actually I was planning to ask this before even I hear him. I still ask, how do you feel ticketing a driver for driving silently and quietly and safely maybe, doing only 10 kilometers over the posted speed limit while giving a blind eye to dozens of speeding, drag racing, driving 160 in a 60, and also so noisy that makes everybody irritable. And believe me, residents of this area now are thinking of taking the matter into their hands, and this is really dangerous.
Well, Khaled, I hope
What
that
do you
wasn't
think?
you that got
No.
pulled over. Certainly, often there are occasions where cars are pulled over for other reasons, and perhaps he wasn't speeding, but perhaps the license plates stickers were, out of date. There are other reasons that cars are pulled over, so I think it's best to allow Inspector Danos to speak to this issue, and anything else on road safety or excessive noise or speeding and road racing that he'd like to add. Thank you. I'll pass it on to him.
Good morning, and thank you for your question, and I appreciate the frustration that you have with the aggressive driving. It's a matter that we all take very seriously in the region of Peel. With respect to your comment about taking action in your own hand, I absolutely support that, and that is why I recommended the Road Watch program. We strongly encourage that our community members do come forward with information, such as the information you provided just now, inputting that information on our website, specifically the Road Watch program, and we will follow up with any areas that are identified to us as high-risk areas for excessive speeds. Also, as I mentioned earlier, the chief added 16 officers to our unit. We have approximately 82 officers dedicated to road safety in the region of Peel. And as the mayor said, officers are pulling over individuals for a host of reasons. It can be anything from an expired VAL tag to dangerous driving. The Highway Traffic Act is a very complex piece of legislation that has many road offenses that our officers will and do enforce. However, the big four, the aggressive driving, the distracted driving, the stunt driving, and the impaired driving are a huge priority for the Peel Regional Police. The stats and the data show that these big four offenses lead to serious injuries and fatalities. Thank you for your questions, and I'm available for any follow-up.
That was actually a second question, so we'll move on to the next one.
Thank you.
Because I got the first one. Thank you. I'm here.
Your final question comes from Pooja Luthra at Y Media. Unfortunately, she was having trouble logging in, so I am going to read the question. These might be for Dr. Lowe.
Sure.
Do you think mental health will be the next pandemic? And also, why are we not opening up indoor gyms, and when can we expect them to open?
I believe the indoor gyms in the next wave, the next phase, and with respect to the mental health, certainly is going to be very challenging, and I'll pass that on to Dr. Lowe.
Thanks, Madam Mayor, and thanks for the questions, Daniel, from Y Media. The decisions as to what is being reopened have been laid out by the provincial framework, and so as Madam Mayor indicated, I believe indoor gyms are in the next step as identified by the province, but as for the rationale, I would encourage you to reach out to our provincial partners to determine what was made into those decisions around the steps. In respect of mental health, let's be very clear, mental health has been a challenge not only in countries like ours, where we have managed to avert some of the very dire images of the pandemic seen elsewhere in the world, but mental health has also suffered in countries that did not have the pandemic under control. I certainly don't think I certainly can't imagine the collective trauma a country like India or a country like Brazil has gone through in seeing their healthcare system overwhelmed, people being cut down in their prime by a virus. So the reality is that a lot of the mental health challenges that we've faced have been because we are in the midst of a human health disaster and not necessarily due to the specific measures that have been taken at this point in time. It is very isolating to be in a situation where you can't go out because you're worried about getting sick and potentially succumbing to the disease. So you are correct. I think everyone collectively around the world has faced a significant trauma throughout this pandemic, whether there were measures taken or whether there weren't measures taken and the virus spun out of control. And for us in Canada, there will need to be a lot of effort into how do we recover, how do we reconnect. And I think that actually brings me to my final point, which is as we get through this final bit of the acute phase of the pandemic, it is even more vital for us to continue to be kind and compassionate. Certainly I've heard of vaccination clinic staff being abused. I've heard of our telephone operators, our contact tracers. It's a lot easier for all of us if we continue to just remember that we're all trying to do our best here and trying to make it through. So, I think mental health certainly will be something on the radar once we get through the acute phase of the pandemic. And I urge everyone to continue to be kind and compassionate in the meantime. Thanks for the question.
Are there any more questions?
That's it for today, Mayor Crombie.
Thank you for joining us.